modalities, it may be appropriate to use non-steroidal anti-inflammatory drugs. It is recommended to use these drugs in conjunction with acetaminophen, not as a replacement. Prior to considering the use of opioids, the dosage of acetaminophen and a non-steroidal should be maximized. It is also advisable to use acetaminophen and non-steroidals concurrently with opioids in order to reduce the required dose of opioids to manage pain. Using opioids in this pain population is not only possible, but it is also often necessary. The first thing to remember is that opioid agonist therapy is titrated to manage the patient's substance use disorder and not to treat pain. The patient should be maintained on their current dose of opioid agonist therapy. It is always recommended that the patient should use short-acting opioids. These opioids should be taken on a regular schedule and not on an as-needed basis. This will reassure the patient that the pain is being taken seriously and will not generate a drug-seeking approach to using the opioids. It is important to be aware that these patients may also require a higher than normal dose to treat their pain adequately. It is important to reassure these patients that their substance use disorder will not prevent adequate pain management and that their current dose of opioid agonist therapy will be maintained so that they do not experience withdrawal symptoms. In summary, the pharmacist should discuss pain management with the patients in a non-judgmental manner. They should recommend using all modalities of pain abatement available aggressively. It is important to understand that higher doses may be required. Always use continuous orders rather than as-needed orders. And lastly, it is not advisable to use mixed agonist-antagonist opioids to treat pain. The following should be considered best practices. In summary, the pharmacist should discuss pain management with the patients in a non-judgmental manner. They should recommend using all modalities of pain abatement available aggressively. It is important to understand that higher doses may be required. Always use continuous orders rather than as-needed orders. And lastly, it is not advisable to use mixed agonist-antagonist opioids to treat pain. The following should be considered best practices for working with opioid agonist therapy patients who have concurrent pain. Reassure the patient that pain management, addressing the patient's concerns, will be very helpful in helping with their pain relief. Confirm the patient's current opioid agonist therapy dose with their prescriber. Notify the opioid agonist therapy prescriber that the patient will require opioid treatment for pain. Wherever possible, the opioid agonist therapy prescriber should also be the sole prescriber for any opioids and benzodiazepines that are used for pain management. Alternatively, should this not be possible, then at the very least, the same pharmacist should be managing the opioid agonist therapy and the pain treatment. This is an ideal opportunity for a pharmacist to coordinate care. We will now move to the second part of the presentation and address several common questions that are presented to the Drug Information and Research Centre at the Ontario Pharmacists Association. Can a pharmacist in Ontario honor a prescription for opioid agonist therapy that is written by a prescriber from outside our province? The short answer to this question is yes. Pharmacists in Ontario may accept these prescriptions. Best practices for narcotics should be followed. These include, but may not be limited to, the following. The pharmacist should confirm the identity and contact information of the physician from an independent source. This may mean checking the licensing body's website or perhaps even calling them to confirm the physician's contact information. Once you have this information, the pharmacist should contact and speak directly with the prescriber to confirm the prescription. The pharmacist should be exceptionally cautious about accepting confirmation from office staff. The pharmacist should also speak with the previous pharmacy to confirm the last witnessed dose. It would be recommended that this be done even if the patient provides evidence of their most recent dose. People are often concerned about having to carry both methadose and metadol in their inventory, but for a number of reasons, these